Hi, my name is Queenie and I work for Wu Community Health and Polk County COVID-19 project. One of our main goals is to inform residents of Polk County about COVID-19 and help prevent the spread of disease in the community. The project was started in June when we signed a contract with Polk County to begin contact tracing. The actual publishing of the data brief started in July. The data brief was originally intended for a small group of people, such as the Polk County Public Health Department, the Public Health Administrator of the county, the President of Western Oregon University, and a few major decision makers in Polk County. These people have some background knowledge in data and data visuals, so we were able to create a more complicated and detailed graphs. They wanted real-time updates about COVID-19, and although the data can be found online on numerous reliable sources, they didn't have the time to find it on their own, and that's where we come in. We create bi-weekly data graph, analyzing graphs with different variables and seeing the trends on COVID-19. But now we have grown and evolved. Our distribution list is 750, adding other members of Polk County such as community-based organizations that are assisting residents affected by the pandemic, as well as other faculty and staff on WU. A quick data brief highlight before I show you the data brief itself. The front page of the data brief is Polk County specific, so all information is mainly about Polk County. And then the back page is national and international news. We interchange the graphs between COVID-19 hotspots and vaccine graphs. It also contains vaccine updates around the world or about the different COVID-19 vaccines that's been coming out. So now I'll be showing you an example of a data brief. This is our data brief from last week, February 22. On top, we have our cumulative case numbers. As of February 22, Oregon had a total case of 152,818. Polk County had 2,981, and Marin County had 18,183. County rankings of incidence, so that's the occurrence of COVID-19 in the population over the last week, and this is out of 36 counties, so first means the highest incidence, so that's bad. Polk County was 15th as of this week, and last week we were at 11th. Marin was 21st, and last week was 20th. So over the past week, this means we've been doing good in terms of lowering our cases. As of February 22, 8 a.m., we've had 99 contacts. These are the individuals that are currently being contacted by the WU contact tracing team. Last week, we had 127 contacts. Again, this shows good progress for the county. Going down to the middle section, we have our graph for the week. In general, we would have 2 to 3 graphs, but for this week, we wanted to solely focus on the risk levels and where Polk County is currently at. The graph contains multiple variables, so I will be breaking it down step by step for everyone. We have the title of the graph. It's Daily New Cases of COVID-19 and Risk Levels, Polk County, Oregon, and the data was from September 1, 2020 till February 21, 2021. Over on the left side of the graph, we have our y-axis, which are new cases per day. And then down on the bottom, we have our x-axis, which are the dates arranged every 2 weeks. We also have our key legends. So the graph is a combination of a bar graph, which is the daily new cases, and a line graph, which is the 7-day average. Usually they're in different colors to distinguish them from each other, but since we're focusing on risk levels and to not make the graph look loud, we made it black. So also on the bottom of the graph, we have the risk levels: extreme risk in red, high risk in orange, and moderate in green. The lines indicate where we need to be or how many cases we would need to have in order to move below the line and into the new risk level. On the top of the graph with the gray and white columns, it shows the daily average cases we've had in 2-week increments. It's 2-week increments because the Oregon Health Authority determines the risk levels by looking at the cases in 2-week chunks. Looking at the graph in general, if you look at the 7-day average line, we can see that there have been 2 peaks of high cases in late November and early January, and this tells us that there have been some gatherings over the holidays. Before looking at the main takeaway of the graph, we have OHA's different risk levels for reference on the right. So extreme risk level is equal to or greater than 200 cases per 100,000, high risk 100 to 199, moderate 50 to 99, and low risk less than 50 per 100,000. With those in mind, we have our main takeaways from the graph on the left side. So in order to move from extreme to high risk, Polk County would need to drop below 200 cases per 100,000 people over 2 weeks. What does that look like in real numbers? We would need less than 166 total cases over a 2-week period and an average of less than 11.8 cases per day. So where have we been? The last time we were at a high-risk level was October 2020, and you can see this on the graph where the bars and 7-day average line fell between the extreme risk and high-risk lines. Where are we now? Like I mentioned, the gray shaded columns represent 2-week periods of where we're at. Currently, we've had 161 total cases over the past 2 weeks and an average of 11.5 cases per day. How about moderate or low risk? So in order to be at a moderate level, we would need an average of 5.9 cases per day, and in order to be at low risk level, we would need to have an average of 3 cases per day. On the far right, we have our Polk County vaccine update. So almost 16% of Polk County has received at least one shot, making the county rank in 3rd place compared to other Oregon counties. And as of February 22, ages 70 plus were eligible for vaccination. For more detailed information on how to schedule an appointment in Polk County, you can visit the Salem Health website or call 503-814-SHOT. The backside of the page, we have national and international news. In this data brief, we are featuring US COVID-19 hotspot in the past week. So lighter color means few cases and darker color means more cases. You can see that there are parts of Texas that have darker color as well as North Dakota and Colorado. So this tells us that they have a lot of COVID-19 cases in the past week. Below the map, we have a virus variant update. The prevalence of variants is increasing. Several of the variants seem to spread more easily and quickly than others, which may lead to more cases of COVID-19. Increase in cases will put more strain on healthcare sources, leading to more hospitalizations and potentially more deaths. Because the efficacy of vaccines against variants are still being studied, social distancing and mask wearing remain extremely important. Below, we have created a table to help you understand the newly published research on the effectiveness of masks. We have a list of the different mask types, its filtration rate, combined efficiency when both people are masked, and its maximum combined efficiency when both people are masked, social distance, and the room has good ventilation. We consider N95 as the gold standard. It has a 95% filtration and 99% or more efficiency. Double masking, which is using cloth over surgical mask, has a filtration of at least 70%, a combined efficiency of 90%, and a maximum combined efficiency of 99%. This tells us that double masking maximizes the mask performance and reduces our exposure to COVID-19. It's definitely something to keep in mind when you're exposed to other people or out in general public. We also have our data brief sources listed below. Again, depending on the week, we have different data sources, but we mainly gather our information from CDC, OHA, New York Times, and World Health Organization. If you wanted to learn more about the WU COVID project, visit our website, which can be found on the WU Community Health page. Thank you.